As we age, our bodies undergo many physiological changes that differ from person to person. For example, some elderly patients may experience a decrease in senses, while others may experience a decline in strength. It is essential for a healthcare professional to differentiate between a disease and an age related physiological change.
Ms. Lopez?
Hi, good morning, Ms. Lopez. How are
Good
you?
morning. I'm doing good.
Are you okay?
Yeah,
Do you
I'm
need help?
okay.
You're
No,
okay?
no, I'm fine. I'm fine.
Okay, so we're going to go ahead and pull this out for you so that you can have a seat in here. How are you? How's your balance at home? How's your walking, your daily activities?
Well, actually, my balance hasn't been that great lately.
Okay, what about your daily activities? Are you able to do that?
They're getting harder and harder for me to do.
Okay, so that does seem, it is normal as we start to age, we do tend to lose our balance a little. So maybe we can look into a cane or a walker for you. You think that will benefit you?
Well, if it'll help me at home.
Yeah. Okay. Knock knock. Good morning, Mrs. Lopez. How are you this morning?
I'm okay.
You good?
Mm-hmm.
Okay. So what we're gonna be doing today is I'm gonna be testing your motor function. Okay, you're gonna squeeze into my hand, sorry, as hard as you can, and then we'll go from there. So you can go ahead. Is that as hard as you can go?
Yeah.
Okay. So it looks like your strength is weak and asymmetrical.
What does that mean?
So as you start to get older, you do start to lose some strength, especially in your hands. So that's why you were able to really hold on to my hands as tight. Okay?
Okay.
Geriatric patients have a reduction in muscle, which is most obvious in the patient's hands. They also show diminished strength and slowed reaction times. Their walk is slower, and they have a hard time maintaining their balance, which increases their risk for falls.
Lopez, I'm going to test out your motor reflexes.
Okay.
Okay.
As the brain ages, deep tendon reflexes can be decreased, or in some cases, absent.
All right, Miss Lopez, we're gonna check your vision today. So I'm gonna ask you to place your right hand over your right eye and look at the chart for me and read the smallest line that you can see. Do you see a number by it?
I think I can see to number 3.
Okay, could you read that line for me?
P L T.
Okay, and if you could place your left hand over your left eye, the same thing, pick the smallest line that you can read and let me know what number you're at.
Can't really see much,
No?
but
Can you see line 1?
yeah, I think that's an E.
Okay, can you read line 2?
No, not really.
You give it one big try.
L P.
Alright, thank you, Ms. Lopez. So your vision, it looks like it's gotten a little bit worse as you've aged. Totally normal though. That's just what happens as we get older. We can't see very well. So maybe we'll get you some glasses and see if that helps, okay?
Okay, thank you.
Okay.
As we age, visual nerves degenerate, leading to a loss of visual acuity and hearing. Sensitivity to glare, decreased peripheral vision, and a constricted visual field occur due to degeneration of visual pathways, resulting in disorientation.
Alrighty, Mrs. Lopez, we're gonna go ahead and check your pupillary reaction times, okay?
Okay.
Alrighty, so go ahead and look straight at me. Go ahead and watch the light for me. Perfect, thank you.
Pupillary responses are reduced or may not appear at all in presence of cataracts.
How you doing, Ms. Lopez?
Hi, okay.
I'm gonna finish your assessment, so we're gonna check your proprioceptors which basically you're just gonna see if you can feel this vibrating on your feet, okay? So could I get you to take off your shoes and socks for me?
Okay, sure.
Alright, so go ahead and close your eyes for me, okay? And I'm gonna put this vibrating on your toe, and then you're gonna tell me if you feel it, and then I'm gonna stop it, and you're gonna tell me when I stop it, okay?
Okay.
Alright, here we go. So close your eyes. Okay, good. Feel anything?
No, I don't feel anything.
Okay, we're gonna try it again, okay? Ready? Tell me when you feel it.
Oh yeah, I feel that. Oh, it stopped.
Okay, good. Alright, we're gonna try the other foot now, okay?
Okay.
Alright, same thing. Can you feel it?
Nope, nothing.
Okay. Alright, again, ready? Tell me when you feel it.
Oh yeah, I kind of feel it.
Anything?
Yep, stopped.
Okay, good. Alright, that's it.
Tactile sensation is dulled in the older adult due to a decrease in the number of sensory receptors.
Hi, Ms. Lopez.
Hi.
So I checked your blood glucose and it's under control, so good job. However, I am going to check your pain sensations because they do become altered when your glucose is out of control, okay?
Okay, but I'm really cold right now.
Oh, okay, let me go grab a blanket really quick.
Okay.
The older adult patient may feel cold more readily than heat and may require extra covering when in bed. A room temperature somewhat higher than usual may be desirable.
Okay, here you go, Ms. Lopez.
Oh, thank you.
You're welcome. Are you feeling better now?
Yeah, much better now.
Okay, so I'm gonna go ahead and check your pain perception now. So can I have you put out your hands? Okay, and I want you to close your eyes and just let me know if you could feel the soft part of the cotton, okay? Do you feel it?
A little.
What about now?
I kind of feel that one.
Okay.
Determining the patient's sensitivity to a sharp object can assess superficial pain perception. With age, reaction to painful stimuli may be decreased.
Hi, Mrs. Lopez. How you doing?
What?
Hi, how are you?
What?
How are you, Mrs. Lopez?
I'm okay.
You're okay? Okay, well, the doctor ordered you some...
I can't hear what you're saying. Can you speak up?
The doctor ordered some Ativan before your procedure.
What procedure?
Auditory nerves degenerate as we age, leading to a loss of hearing.
Good afternoon. I'm going to be your nurse for today. Can you go ahead and tell me your name?
My name is Mrs. Lopez.
Hi, Mrs. Lopez. Nice to meet you. Can you go ahead and tell me your date of birth?
My date of birth is January 1st, 1940.
Awesome. And can you go ahead and tell me if you have any allergies?
No, I don't have any allergies.
Okay, thank you.
Mental processing time decreases with age. Memory, language, and judgment capacities remain intact, but the time between each of these responses can diminish. However, changes in mental status should never be assumed to be a normal process and should be evaluated further.
So, Mrs. Lopez, what did you have for breakfast this morning?
We had breakfast already?
Yeah. Do you remember where you went to high school?
In my hometown.
Do you remember where your hometown was?
No.
Mrs. Lopez, you usually remember what you ate for breakfast. I'm going to go ahead and do your vital signs, and then we're going to conduct a more thorough neuro assessment to see what's going on, okay? Just go ahead and lay back.
Delirium, transient mental confusion usually with delusions and hallucinations, is seen in older adult patients who have underlying CNS damage or are experiencing an acute condition such as infection, adverse medication reaction, or dehydration. In summary, while assessing neurological function, Some gerontological considerations should include structural and physiological changes, mental and sensory alterations, temperature regulation, pain perception, and mental status. The nurse should take into consideration that any neurological deficit can greatly hinder one's ability to complete ADLs, mobility, and even coping strategies, so the nurse should plan care accordingly. The nurse should also consider a patient's individual needs before providing education. Patients with visual deficits may require additional aids, such as pamphlets with large print and contrasting colors. And clients with hearing deficits may require the educator to speak in an unrushed pace, clear tone, and possibly even an ASL interpreter. Patients with any learning deficits may require the nurse to keep all information short, simple, and to the point.